I admit everyone. Okay, live streaming already started, Kak. Go ahead.
All right. Hello, everyone. Good evening and welcome to Britzone Thursday class. My name is Nisa and I'll be your MC for this class. Maybe before we start the class, if you are available, please to turn on your camera, ya guys. We are really happy and appreciate if you can open your camera. Okay, thank you guys for opening the camera. Really appreciate it. And I see there are some people here who are already joining our class. Maybe I want to greet and say hi first to some of you. Let me start with Kak Rasya. Hello, Kak Rasya.
Halo Kak Khairunisa.
Yeah, meet you again here. Hello,
Yeah,
thank you for joining our class.
right.
How's your day going so far, Kak?
Yeah, it's pretty good, I guess lah. I've doing some exercise, I guess.
Glad to hear that, Kak.
Alright.
Um, and may I ask, what made you want to join this session, Kak?
Sorry?
What made you want to join this session, Kak Rasya?
Because it's related to my background, I guess lah, as a software engineer, and I also develop something like that related to AI. So I'm very enthusiastic to join this session right now.
Thank you, Kak Rasya. We're so happy to have you here.
Right. Thank you.
Maybe I will say hi to another person. Maybe Kak Adi. Halo, Kak Adi.
Halo Kak Herlisa,
Yeah, how are you, Kak?
I'm great today. What about you?
I'm good also. Thank you for asking.
Yes.
And how about you, Kak? What made you curious about this class?
I had an experience in the cervical cancer, especially cervical cancer, with my mom in the past few years ago. In fact, past 10 years ago, perhaps. My mom experienced cervical cancer, and I used to accompany her in one of the moments in the hospital.
I see. And hopefully today's session can give you new insight ya, Kak, about this topic, so especially for cervical cancer.
Yes, I hope so.
Okay, thank you, Kak. And maybe before we start the class, I would like to share a little announcement first about Britzone. Uh, okay, thank you, Kak Kasmal. Okay, guys, so welcome to Britzone. Britzone is the largest English community in Indonesia. And we focus on providing free and open access English education for everyone who wants to learn and grow together. And our community is based on volunteerism, and we're so happy to have you here today. So Britzone have the four regular classes. The first one is Britzone Tuesday class. It held online and offline every Tuesday and start at 7 p.m. For the offline class, it will held in Perpus Kemendikbud Jakarta ya. And the second, it's Britzone Thursday class. Like today, it held every Thursday and starts at 7 p.m. And it always held online, so you can join from anywhere. And the third one is Britzone Saturday Fun Class. So besides learning from the conductor and joining FGD session, we also having fun together with special fun games in every session. So it's always fun and a great chance to meet you in a person. And the last one is Britzone Outdoor Class. It holds once a month on Saturday. And for this month, it's already done in Taman Suropati Menteng ya for celebrate Jakarta's birthday. And stay tuned to our upcoming outdoor class ya guys in the next month. And our community have general guidelines. The first one is please be respectful and kind to others' opinion. And the second, please seek permission, especially if you want to taking a pictures or videos during class. And the last one is avoid discrimination. Okay. And of course, our communities will be take action for it. Yeah, if you witness behavior that violates these guidelines, please report it to the facilitator or Britzone management. And this is our social media. The first one is our Instagram is @BritzzoneID. We share the information of the upcoming class in Instagram. And also we have a YouTube channel. It's Britzone English Community. You can also stream our online class in YouTube. And the third is TikTok. We have also our TikTok social media account. It's Britzone ID. And the last one is Discord. You can also have chit chat with members with in Sunday with in Discord community. Oh yeah, so please scan this barcode yeah for you who want to join our Discord. And we're sponsored by Perpustakaan Kemendikbudrismen. If you want to sign up for becoming member of the library to access impressive resources, just click the Instagram. It's @Perpustakaandikbud. And this is our Thursday class tradition. The first one is please to turn on your camera. Yeah, we really happy and appreciate if you can open your camera. And the second is the taking picture. We also have taking picture session uh, uh, after Q&A session. And the third one is please fill out the attendance form after the class. Okay, that's it for the announcement. And maybe we can move to the next session. It is presentation material from our conductor. Okay, please welcome Kak Nidya as our conductor. Halo Kak Nidya.
Halo Kak, by the way, there's Adhan in my neighborhood. Is it too loud? Should we wait?
Okay, it's okay. Please wait a minute for a second ya.
Okay. Yep, it's done, Kak.
Alright. How are you, Kak Nidya?
Hi. Actually, I have like a really tiring day today, but I'm still excited to meet you all tonight. Yeah,
Good. We are really appreciate your energy, Kak.
oh, it's okay. So excited.
And we really cannot wait to hearing insightful thoughts from you about AI for cervical cancer screening. And maybe it's your time, Kak. The time and screen yours.
Okay, thank you so much, Kanisa. Actually, I'm so excited, but I'm also very nervous because I heard that Kak Rasha is like a software engineer and have experience in AI. Hopefully we can learn together tonight. I'm not like the best person to, maybe I might not be the best person to like tell you about this, but I'm trying my best, like as much as my knowledge. Okay. So hopefully we can have fun tonight. So let me share my screen. Okay. The title is like already overwhelming, right? AI for cervical cancer. AI plus cervical cancer. Hopefully it's gonna be like a fun session tonight. So first, let me introduce myself. So my name is Nidya Anifa. You can call me Nidya. I was born in Bantul, Yogyakarta, but then since 2019, I live in around Jabodetabek, right? So I study biomedical engineering in University of Indonesia. And after I graduate, I work as a pre-sale engineer at an IoT company called Lacak.io. And related to what I'm going to talk about tonight, so I have internship experience in IMERI FKUI. It's like a research center from FKUI. And then I was also a Bangkit Academy cohort. It's a program from, it's like a joint program from Google, Tokopedia, and Traveloka, and also Kemenristek Dikti. And I was also lucky enough to be to be the mentor for Bangkit Academy for 3 consecutive batches. And I was also Apple Developer Academy at BINUS cohort at 2023. And I'm also a co-founder of HerLens. So why I'm highlighting HerLens with a teal green color? Because this is what I'm going to talk about. So if you're curious about HerLens, I will tell you later what is HerLens. So related to my background, I strongly believe that technology can play a primary or key role in providing an accessible healthcare for all. What I mean by accessible, it's easy to access, like cheap, and can be accessed for everyone in everywhere. But first, I want to ask you something. Are you familiar with this logo? And have you used this app? And please react with thumbs up if you think this bring a positive impact, and react with thumbs down if you think this bring a negative impact. Okay, let me see if you have any response to my questions. Okay, I think some people are familiar with this product or technology. So can you tell me what is the name of this solution or technology? Can anyone tell me? Yes, Kak Nadila, I also use this technology very frequent in my daily life. Sometimes I even like told my chat GPT about my day. It's kind of like a virtual friend right now. Yes, exactly, like a friend. Okay, I actually cannot see like your reaction with the thumbs up or thumbs down. So can you please send like, is there anyone that think this app bring like a negative impact? I think some people like have a different opinion about this new emerging technology. Yes, there's also DeepSeek. There's also Gemini or Gemini. I don't know how to call it. Yeah, there's so many AI generative AI product or LLM product in this era. Yes, Grok as well. It's from Twitter or X, sorry. So what the chat GPT is one of the example of AI, right? But what is AI anyway? So I kind of like confused, like what should I put in this slide, because I have a very wide, like definition. But from the father of AI himself, he said AI is the science and engineering of making intelligent machine. But like for a much simpler definition, I think AI is like a technology that makes machine can learn, like can think just like human do. But for the perspective of AI, if human, we learn from experience, right? When we fall, we feel like our knees like a scratch and then bleeding, and oh, okay, I have to be careful next time. But for AI, they also learn from like experience, not experience, but data. I think data is like they learn from many data, and that's how they can have like the intelligence. But sometimes it's a very like new technology, right? I cannot say it's new. Maybe some people are more exposed to AI these days because of the emerging of like ChatGPT, and like these days we can like make a new video or new image only from prompt. But actually AI has been around us all of this time. Yes, AI has been around us all of this time. For example, personalized ads. Like, have this experience when you search for a shoes? You only search about shoes one time, and suddenly you have so many ads about shoes from different e-commerce, like from different platform, and suddenly like they flooding you with information of shoes. That's because we send the data, like we interest about shoes, and then the AI learn about that, and they will looking for information about shoes and try to sell shoes to you. Sometimes we even thought that maybe our phone can hear like our daily conversation, or maybe our phone send this kind of data. I cannot say if it's true or not, but for example, if you search for shoes, you will get many ads of shoes. And also, some of our phone have like this feature of face recognition to unlock the phone. Actually, it is also one of the example of AI, because AI so first AI already learned about the feature of human face from so many data of like human photos, like human portrait. And we like sign up to our phone, like when we first have our phone, we will like register our face like to our phone, right? So that's when the AI in our phone will learn much more specific feature about our face. But actually they already learn about so many face from many people, because like how can they even know where is our eyes, where is our nose? Yeah, that's because they already learn about the human face feature from so many data. And also, actually, like I'm like contemplating first about like how should I make this presentation, but then I decided to like jump immediately to one of the example of AI in medicine. But actually, there's so many example of the use of AI, or even the use of AI in medicine. But tonight I want to talk specifically about AI for cervical cancer screening, because this has been what I've been working for with my team. So yeah, let's learn more about AI for cervical cancer screening. But first, let's learn together about cervical cancer. So cervical cancer is a cancer that starts in the cells of cervix, or in Indonesia, it's leher rahim. So in the lower part of the uterus that's open into the vagina. And this cervical cancer is mostly caused by human papilloma virus, or HPV. And this cancer is actually very highly preventable with HPV vaccination. If you've heard like about the campaign of cheap HPV vaccination and etc. Actually, that is one of the way how we can prevent cervical cancer. And also, we can also do regular screening, such as pap smear and VIA test, and also early treatment. And if cervical cancer is detected early, cervical cancer is highly or mostly successful to be treated. But sadly, most of the cases are the cancer is detected too late. So yeah, in Indonesia, cervical cancer is the second most common cancer among Indonesian women. However, the 70% of these cases are found too late. So it results to 90,000 deaths per year. One of the widely used cervical cancer screening tests is the VIA test. However, it only has 66% accuracy. Yes, it is very, very low. So you might be wondering how cervical cancer is screened today. So maybe it will be like very technical, but I will try to explain it briefly. So how cervical cancer is screened today is the doctor will open the vagina with a speculum, and then they will swab the cervix with acetic acid, and then they will wait for 1 minute to see if there is any discoloration or color changing in the cervix. And they only see it with their own naked eye. And this process is called visual inspection with acetic acid. And this test is highly subjective and also highly depend on the experience of the health workers. Actually, maybe some of you already know about pap smear. What is the difference between VIA test and pap smear? Up until this part, so when we do the pap smear, the doctor will open the vagina and they will get a sample of the cervix cell and send it to the laboratory. That's why this method is very expensive and also take much longer time. That's why in a very, very early stage of screening, the doctor will tell the patient to do the VIA test first because it is much cheaper and highly accessible in puskesmas, clinic, or hospital. However, the reality is the naked eye is not enough. And that's why we need AI interpretation to add an extra layer of confirmation for the doctor. So actually, we're not replacing any process. If you can see the image here, instead, we enhancing this process by adding an extra layer of this confirmation from AI. So how does the AI do the interpretation? So the AI model will learn from so many images of cervical image, and the specialist, the gynecology and oncology specialist already label these images with VIA positive or VIA negative. And then the AI model will learn from the collected data. And then when the AI is exposed with a new image, the AI can give us the interpretation based on the data that it has been learned, sorry. So with this new AI model with accuracy of 85% plus the accuracy of the health worker, because if you see this image, we are not removing the job of the doctor, because at the end of the day, the one that will confirm the final diagnosis is doctor, because we already know that the doctor has like more knowledge about the human body, about the health, about the medicine, instead of our AI, right? Because our AI only learn from images. That's why we highly respect the opinion of the doctor. So at the end of the day, the one that will confirm the final diagnosis is still the doctor. So combining both, we can get up to 95% accuracy. How good is that? So what is the technology that can help us to get the interpretation of AI for cervical cancer? This technology is called HerLens. It has been developed by our team since 2023, and we have a vision to bringing a life-saving tool for all women who need it the most, especially here in Indonesia or in a rural area of Indonesia where an accurate screening might not be easy to access. That's why HerLens will come in and bring more accurate screening tests everywhere. So maybe I want to proudly share a bit about HerLens achievement. We have been granted with as a winner for NUS Singapore Health this year, and also last May I pitched at Live Her Grand Challenge in Melbourne, and also we have been honored to be a winner of the US-ASEAN Science, Technology and Innovation Corporation last year, and we have also joined some like accelerators and also incubators. And till today, till right now, even this afternoon, I also met the doctors and professors from RSCM to talk and to discuss about the pilot project that we have been started, like we have been initiated with the RSCM. We have start our pilot project to, our pilot testing in RSCM. And also, yeah, if you are curious to know more about HerLens, you can go to our website and also our Instagram. And if you also have like more question, you can ask me directly. Thank you so much.
Thank you so much, Nidya, for this inspiring and insightful session. That was really interesting, especially for me personally, yeah, because AI nowadays is something we see in our daily lives, yeah, but I didn't expect how impactful it could be in a healthcare, especially for something as important as cervical cancer screening. And it's
Yes.
amazing, yeah, to see how your innovation can really help save lives, especially for women. Thank you so much, Kanidia, for sharing this insight with us.
Thank you, Kak.
And I'm sure many of us learned something new today. And maybe if you want to have any question, yeah, feel free to raise your hand, yeah, guys. If you want to ask Kanidia more, just raise your hand. Okay, go ahead, Karasha.
Okay, I would like to ask something about the HerLens applications. So, at first, I want to say it's an very good application that will solve a lot of problems in the world, especially for a woman that maybe they cannot find or they cannot find out something that to prevent a disease like cancer, and we cannot see it immediately with our bare eyes. So we need this kind of application. So my question is, have you get a feedback from the user that has used this application? What is their feedback, or what is their experience after use this application? Have they been tested, or is there any experience that they actually have that disease or have not, and how accurate it is? How can you make sure to the user that the result of this application is very accurate, and we can prevent or do something quickly after we use this application? That is my question. Thank you.
Okay, thank you so much, Kak Rasya, for your question. Uh, First, sorry, because you have so many questions. So, wait, my friend is coming to my course, so I will open the door first. I'm so sorry. Let me open the door for her. Okay, I am back, guys. Okay, so for your first question, and if there's any question that I like missed, please tell me. Yeah. So first, have we used this app for the user? So I don't know if most of you notice, because sometimes people like get like wrong idea about this app. So the user of this app is doctors and midwives, not like general public, not all women. So it will be used by doctors and midwives. So for the second question, like have we used sorry, for the question like how have we used this app? Yes, we have. Actually, since last year in September, we have initiated our pilot testing with RSCM. So every Tuesday and Friday in RSCM Kintani, every patient that will be tested with the VIA test, the doctors and midwives will use HerLens to first to like test our app and also to test our AI model as well. So how is the feedback from them? Maybe I can give the feedback like from two different perspectives. First, from the perspective of the user itself, from the doctors and midwives, actually we are very grateful because they are very excited about this solution. They also very supportive because, as you know, we cannot test our app, our product if they like don't give us green light, right? Because the user itself is the doctors and the midwives, and also the professors and the specialists from oncology and gynecology department are very supportive. They give us so many feedbacks. They give us also so many guidance because interestingly, the background of our team is mostly from the computer science. So we we might have like lack of a background for the medicine. That's why we seek for advisor for from the doctors and professors of RSCM FKUI. So we're very grateful for that. And sorry, is there any question? Yeah, and also from the perspective of the general public, or especially the women in Indonesia, or maybe sorry, in Jakarta first, right? Because we only test this app in Jakarta and Jabodetabek. So actually we have like a socialization in Puskesmas in Bogor, and when we introduce it, so many people are filling the form because we spread out like some form for them to fill out, and most of them are very supportive about this product, because they also think that accurate screening are very important for everyone, right? And also what most touching is when we do our pilot testing in RSCM, sometimes the ibu-ibu are like curhat to us, because it makes me cry as well, because they also like they feel so scared, to get tested. Actually, they don't really know if it will be positive or negative, and they say like, even if it's positive, I still feel scared. Even if it's negative, I still feel scared. And that's really hit us hard, and we are like more motivated to make a more accurate AI model, more easier to access application, so we can give like the best solution for all women in Indonesia. Yes.
Sorry, maybe you haven't answered the last question, is how accurate the model is after the doctor has already tested it.
Okay, so from our initial training, the accuracy is 85%, but as we collect more data, the data from the testing, we will train it. Like we also searching and researching, like, is there any more powerful AI method for this solution as well? Because as we know, AI is very emerging right now. There's so many new papers, new journals in and research about AI. So yeah, but we aim for more than 90%, of course, because in medicine, 85 is not accepted, right? Because it's like a matter of health of human, and it's something that we highly respect of. So yeah, we aim for 90%, but right now we have achieved 85%.
Okay, thank you so much, Kak, for the answer.
Yeah. Thank you so much, Kak Rasha, and maybe I will try to read the question from the comment section. Does this app actually works in limited internet access? Actually, for the first stage of this app, interestingly, we use a local model. Yeah, because it's much more safer for now, because we need to build a very strong backend that is safe. But right now, because it is in a testing stage, so we store the image locally. We also store the AI model locally in our testing phone. But we planning to make it work for two cases, like when the internet is bad, they can like predict the image offline, and when the internet is better, they can send the data to the cloud. Because not only accurate AI screening, our goal is not only accurate AI screening, but we also want to make a more accurate, more robust data of cervical cancer in Indonesia as well. That is like our future goal as well. Is our puskesmas already equipped by this AI to detect the cancer? Sadly, we haven't, because we already been established last year, and medical device is not as easy to be sell like other product. We need to do some regulation works, some testing and etc. So hopefully we can launch this product next year. So please support us, guys. Hopefully we can use this product very soon. But right now, this HerLens product is only be used in RSCM as our partner. Yeah. Sorry, is there any question that I skip?
Yeah. Thank you so much, Nidya, for answering this question. Yeah, hopefully it can give you guys more clarity and insight into this two topic. Anyone else, guys, who wants to ask to Nidya? Feel free to raise your hand, yeah, or type them in chat box. All right, Kak Adi, go ahead, Kak.
Okay, thank you, Kak Anissa. Halo, Kak Nidya. Since AI has been so helpful to solve many problems, and it's such a groundbreaking, yeah, to have AI nowadays that can, effectively, especially help problems in medical area. I would like to ask, are you planning to maybe uh, try to solve some other kind of diseases with AI after like cervical cancer? Thank you.
Okay, thank you so much, Kak. Actually, if you ask me, of course, I would want to, and our team as well. Like when we are asked about like our like long roadmap, we also hope that after we establish this product, we can branch mark this solution to other diseases as well. Because actually, my thesis is about AI for COVID because I was graduated when COVID is emerging, and also there are also so many example of the use of AI in medicine. So hopefully, in the future, after we have like established this product strongly, we can benchmark this solution to other diseases as well.
Okay, thank you. Maybe you can mention one disease that you are very interested to work on in the next project, maybe?
Yeah, actually, it's kind of like too much information or TMI. So when I first like searching for a topic for my thesis or scriptsy, aside of COVID, I also thought about how we can detect Alzheimer, or how we can detect Alzheimer from the audio, or not audio, like how we speak, how like is there any early sign of Alzheimer from the way we speak? Because my grandmother's some of my also my relative, my distant relative, they has been diagnosed with Alzheimer, and I also have this very deep fear about forgetting things, like imagine if we cannot remember anything, or imagine if our family cannot remember us. So I'm really interested with that disease, but maybe for now I will focus for cervical cancer first. But in the
Okay,
future,
thank
maybe, yeah, who knows?
Yeah, we hope so, Eka. We will wait for that. Thank you so much, Kak Nidia.
Thank you.
Thank you, Kanista.
Oh, there's a question from Kak Dia ya, Kanisa ya. Can I answer it, Kak?
Oh yeah, go ahead, Kak.
Okay. How we comes up with this idea to make HerLens, beside from the real data that says cervical cancer is difficult to see in naked eyes, is there any personal experience that motivate you, Kanidia? Okay, so maybe I don't know if we have time, but I will like shortly tell you an interesting fact about the background of my team. So actually, my team we are team up in Apple Developer Academy, and actually HerLens is like a final project for that program. So we team up, 7 of us. Yeah, it's very large group. And interestingly, we are from the same university. Yeah, we used to like get like they used to make fun of us like, ah, you guys are team up because you are from the same university. But actually, what like brought us together is we sit together like in a cafe, and then we tell about our concern one by one. And interestingly and sadly, we have the same experience of uh, losing our family or our loved ones due to late diagnosed diseases. And for me, it was my father. He was detected with heart disease too late. So it's very heartbreaking. And also specifically, one of our co-founder, Alfie, her mother, we lost her mother due to cancer in 2022. And maybe that's what have been motivate us. We have the same pain of losing our loved ones due to late diagnosed diseases. And then I actually have team up together and to research about cervical cancer, and that's when I propose the solution to our team. And since then, we have been working really hard to develop this product. And maybe that's also what motivates us to like go forward, because making a solution like this, like we said, from our 9 to 5 or corporate jobs is not easy. But yeah, we have been stay like close together in our team. I'm so grateful with my team because like they are like the best team like to work with. So maybe that's also one of the motivation from me. Yeah.
Thank you, Kak Nidya, for answering Kak Diah question. Yeah, it's hopefully answering Kak Diah question. Yeah. And maybe before we continue to the next part of the session, maybe there's some announcement first from our entry team. Halo Kak Tito.
Hi, thank you so much for giving us time. Can you please help me to share screen about the brand? Okay, guys, before we move to the next session into our FGD session, let's take a moment to check out something that we've been working on behind the scenes. We are excited to introduce our official Britzone merchandise, created to celebrate and support the connection we have with Britzone. And here we have, wait, yeah, we have 3 special merchandises just for you. The first one is Busy Apparel, everywhere with a cause, super stylish, super comfortable, and a great way to represent our bond together with Britzone. And the second one is here, Busy Career, your go-to waterproof tote bag for errand, work, and also for, events. So it's the function meets sustainability. And last but not least is the Busy Connect. We are trying to merge the convenience and community identity where your daily ride now with Busy Pride, where English brings us closer. Oh, you're gonna see, yeah, something like that. And yes, every purchase contributes to our ongoing community activities. So please check out our merchandise by scanning the QR code here, and also by owning a piece. You are also helping us to, share, support, connect, and also spread our existence to the world around. So please, yeah, thank you so much.
Thank you, Kak Tito. And yeah, please support us by buying our merchandise ya guys. Just scan this QR code. Okay. Maybe we can move to the next session. It's a Thursday class tradition. We can also have taking picture together, guys. So feel free to turn on your camera, ya guys. We're really happy if you can turn on your camera.
Dadah. Maka gadasu.
Okay, so I will start take the screenshot. We only have like 2 screen, and I don't know where you guys are. Just keep posting. I will start counting 1, 2, 3. All right, hold on. I'm going to the second slide. All right, 1, 2, 3. All right, awesome. Thank you so much for showing your beautiful smiles, guys. And yeah, we're gonna start the FGD session, yeah, guys, now. Okay, so I will send you guys to the breakout rooms. Just accept the invitations to go there and enjoy the sessions, guys.
Okay, good afternoon, good night, everyone. Here we are in the main room. So in here, I see there are 3 people already joined our FGD session. So we have Kak Nurul, Kak Hendy, and also Kak Sultan. And Kak Nidya, you can stay here. If you have any thoughts, just tell us, Kak Nidya. Thank you. Okay, hello everyone. My name is Kasmal. So I will be your facilitator for tonight, the main room. So I think we already listened to our conductor material, right? Because I think the topic is very interesting and also very helpful to a lot of people, I guess. So before we begin, I think I would like to each of you to give us a short introduction about yourself, and maybe we can start with Kak Nurul. Go ahead, Kak Nurul.
Hello, good night, everyone. My name is Nurul, and I live in South Tangerang.
South Tangerang. Okay, yeah. What is your occupation, Kak Nurul?
My occupation is I'm an IT staff.
IT staff. So you are related to this kind of topic, right?
Yeah,
Yeah, okay. So this is your
kind
first
of.
time, Kak? Okay, this is your first time, Kak Nurul, to join Britzone?
No, this is my second time.
I see. So welcome back. Hopefully that you can stay again with our next classes. Thank you, Kak Nurul. And we have Kak Hendy here. Hello, Kak Hendy. Can you give us a short introduction to Kak Hendy?
Hello, everyone. My name is Handi, and I'm currently working and reside in South Jakarta.
I see.
So, yeah, nice to meet you all.
Yeah, nice
And I'm
to meet
working
you.
as an administration staff. It has
I see.
nothing to do with the topic, but
It's okay,
it's
Kak.
intriguing. It's intriguing, yeah.
Yes, of course. I couldn't agree more. It's very intriguing. Thank you, Kaini. So I remember you like you are like our regular Black member, right, Kaini? So welcome back, Kak. Nice to have you here in our Thursday class. And the last one we have Kak Sultan. Hello, Kak Sultan. Can you give us a short introduction to Kak?
Hello. Do you hear me, Kak?
Yes, I hear you, Kak. Clearly.
Okay. Hello, good night, everyone. My name is Sultan.
Mhm.
I living in West Jakarta, and my occupation is I'm a graphic designer and part-time research assistant. Thank you. Nice to meet
Wow.
you all.
Oh, that's okay. Nice to meet you too, Kak Sultan. Okay, everyone, before we begin, so tonight we will have a fun discussion, I guess, because we here to talk about something that blends technology and health in a way that could literally save lives, right? And so, like, who knows that we are diving into how AI is being used in cervical cancer screening. I think it's very intriguing, like Handy said before, because AI already now helping doctors and health workers detect things more accurately. So it's kind of amazing, I think. So I think we will start the first question. We will start with Kak Nurul. So Kak Nurul, before you are in the IT department, it's just like a warming up question, Kak. Have you used AI before, Kak Nurul, in your daily life, maybe?
Use AI.
Mm-hmm.
Just ChatGPT.
I see. So what for, Kak Nurul? To helping you more
Mostly about
productively, I think?
mostly about the grammar correction.
Mm-hmm. I see.
Yeah, grammar
Ah.
correction, or sometimes I ask ChatGPT how it is built.
Mm-hmm.
Uh, also curious about how ChatGPT uh, done the data training.
Mm-hmm.
How can they get all of those data, etc.
I see. So you use that as your daily companion to your work. Is that correct, Kak Nurul?
Yeah.
Yeah, yeah. Okay, thank you, Kak Nurul. So how about you, Kak Handy?
Yeah, I'm familiar with AI, but mostly just to help me finish the mundane tasks like
I see.
clearing datas, and then like write in some, what is it, like formal letters that I'm too, so I don't have to think about the choice of words, and yeah, mostly about that, about the mundane tasks,
I
just
see.
to shorten time.
Yeah, okay. Wow, that's a good using of AI too, Kak Hendy. And the last, how about you, Kak Sultan? So you are a graphic designer, right? So I bet that
Yeah.
you are using a lot of AI in your work, maybe?
Actually, AI is convenient for me. I use it for
Mm-hmm.
a lot. Besides for in the context of my job as a graphic designer, I
Mm-hmm.
tend to use AI to generate some like a background or some other object
Mm-hmm.
things. As the first thing is everything on the AI is like free commercial license, so it's very safe for publishing it to my work.
Mm-hmm.
And beside of that, AI is also helping me for learning English as like grammar checking, or sometimes I do the voice call AI, so I just like talked with an AI, and it
Mm-hmm.
really helped me to improving my speaking and the composure when having a daily conversation or something. And I
Okay.
use it for a lot of things.
Oh, yeah. Okay. That's a nice view, Kak Sultan. Thank you. So, all of you like said that AI already helping you to do some tasks, right? So, I think we will start with the first question to Kak Nurul. So it's more specific, like Kak Nurul. So, how's your opinion about AI being used to support medical decisions, Kak Nurul? Like HerLens before.
Sorry, could you repeat?
Okay. So, how's your opinion about AI being used to support medical decisions? So because like HerLens app is help doctor make medical decisions, right? So what do you think about that, Kak?
Yeah, I think it will be very beneficial
Mm-hmm.
for healthcare, and as long as the accuracy is good, and
Mm-hmm.
the result can be accountable,
Mm-hmm.
and
Okay,
also it will be a great start to expand more beneficial applications for healthcare.
I see. Okay, so you think it will be beneficial. So what benefits do you think that AI brings to healthcare that humans alone might not provide, Kak Nurul?
uh, Maybe the efficiency,
Efficiency. Okay, interesting.
because sometimes human can do human error, right?
Okay.
They are prone to human error, but
Mm-hmm.
with application, with the automatic system, it will give you the more accurate and less error.
Okay, so it all about the
Automatic, yeah.
accuracy. Oh, automatic and also accuracy.
Yeah.
Okay, yeah, that's a nice view. Thank you, Colonel, for sharing with us. And how about you, Andy? The question is the same. So, how is your opinion about AI to support medical decisions, Kak?
Well, it would be great use because AI, like we stored a lot of knowledge and informations about everything in the cloud. So I think it takes a lot of time for us to skim all that. So AI could be like a really great use to do all that, and obviously and hopefully able to make a decision out of it. But we shouldn't just let AI decide what to do, because I think it's very critical. It related to human lives, so it's also important to what is it to also make humans take part in the decision making. We wouldn't want to, like the admin here said, we wouldn't want to leave our fate to the machine only. So it's best to also like uh, got our humans in the team. Yeah, because humanities is something that our AI haven't developed yet. So
Okay, that's very interesting thought. So, there will be the risk, right? So maybe can you share us, are there any risks if we too much rely on AI, especially in medical decisions, kind of?
I think so, because I feel like AI is like having a hard time to decide what things that morally right or not. I think we face, I don't know, but I feel like that kind of situations happens a lot in medical field, right? Which one's best to do for the passions, or to yeah, what to say and what not to say to the passion. And
Okay.
yeah, AI, I think having like developed the ability to do all that, it takes like humanity to do that. So
I
yeah, I feel
see.
like it's still lacking. But yeah, if we like uh what is it, like actually use it with humans or doctors behind it, then it could be great use.
Okay, so we just use AI as a partner, not like the main decision. Is that correct, Henry?
Yeah, I feel like more of a sporting role, but I don't
Oh,
know.
I see. Okay, yeah, that's okay. Thank you, Kak Henry, for sharing with us. And how about you, Kak Sultan? I think the question is still the same. How is your opinion about AI being used to support medical decisions?
I think it's same as what the Kak Handy said,
Mhm.
related about how the AI already got the database, or we already unconsciously train them or help them to improve their database. So
Mhm.
in my opinion, if we're talking about if in the context of medicine or health thing, they are got their own database related
Okay.
about a disease or something, I think
Mhm.
AI could be more convenient, could
Okay.
be an efficient way to I don't know, to identify something as they perhaps they got themselves the specific database related about maybe the index of the diseases or the index of
Yeah.
kind of viruses. So
Okay.
maybe it could be a good second opinion or a good like
Mm.
preliminary to decide something.
Okay. So with that kind of database, maybe we can replace Google with AI, right? So if we have any question about what is the meaning of disease, we also can ask to AI too. Is that correct, Sultan?
Yes, something like that. But
Oh.
if we said about the AI summary and search engine,
Mhm.
we still cannot say if it's 100% legit, as we
Mhm.
cannot say which page they make the summary from. But the
Mhm.
specific thing, if they like make their own database, they write themselves, I think it's perhaps got some legitimacy, more
Mhm.
reliable than the Google search itself.
Okay, wow, that is interesting. So, Kak Sultan, if you were a patient, how would you feel knowing that your diagnosis involved AI assistance, Kak Sultan?
Yeah, maybe even it's not in the AI thing, AI times.
Mhm. Mhm.
Even in era of Halodoc things, I already
Ah,
like got some less trust about believing what a doctor said. Maybe we got the
Okay.
possibilities that the doctors maybe just Google or something, and in the end of the day, sometimes it's not about how the doctor judges.
Okay.
Sometimes it's about when you are a patient.
Mhm.
Sometimes your psychology make felt better when you just go to the doctor, even it's just a
I
small
see.
small sickness or something.
Yeah, okay. Because it feels different that when we talk
Yes,
to the real doctor and also the online doctor.
yes,
Wow, thank you, Kak Sultan, for sharing
yeah,
with us.
yeah.
Okay, so we move on to the next question to Kak Nurul. Kak Nurul, so maybe can you give more examples or ideas about how AI is used in medicines, Kak?
Medicine. Um. Oh yeah. Um. I have no idea.
Okay, just speak your mind, Kak Nurul.
um. Maybe to decide the what is penyakit.
Disease?
Decide the disease based on the symptoms. Based
Ah,
on the symptoms
okay.
yang terlihat apa?
Show?
On the symptoms shows on the patient's face or patient uh physic
I
physical
see.
appearance. Yeah.
Or maybe what do you think that in which part of the medical aspect that AI will have the biggest impact to make a diagnostic or to help make a medicine or something like that, Kak Nurul? Or in the operating room, maybe?
Or the operating room, they can use
Mhm.
robot maybe, yeah.
I
Assistant
see.
robot
Okay.
to do
Ah,
some procedure in the theater room.
or being the assistant. It's right, Kak
Having
Nurul.
the assistants, yeah.
Yeah. Okay. Yeah, that's works too. I think so. Who knows that in the future that it will happen, right? So
Yeah.
because AI is growing rapidly. Okay, thank you, Kak Nurul. How about you, Kak Henry? How can you give more example or ideas about how AI is used in the medicine?
Well, this is like pretty new for me. I just knew that
Okay.
you could use AI in the medical field because I thought
Mm-hmm.
it is something AI couldn't do, but I guess we are so far ahead in the what is it in the AI technology. But maybe I think this is one of those things where AI could help to
Okay.
diagnose what is it the diagnostics
Mm-hmm.
being somewhat faster because maybe back when trying to diagnose cervical what is it the disease I forgot, but it's probably take a lot of like process. It takes a lot of uh, time to actually diagnose, but maybe
Mm-hmm.
by having AI on our side, it could
Mm-hmm.
like save us some more time. Uh, but we should like we should not let the doctors like not watching the AI because it's important once
Mm-hmm.
again to have a real human in this case.
Okay, so you believe that it will help the diagnostic process. Is that correct, Andy, from your point of view, Kak?
Yeah, I guess yeah. Maybe it could be like implemented in a lot of DCs, but it's more of a like to what is it to shorten the process of doing diagnostics.
Okay, so maybe have you personally come across AI in a medical context, Kak? Maybe like you using a health apps, or wearable devices or something like that, Andy?
Oh yeah, probably. I think there's a lot of like watch or sleep schedule, and then
Yeah.
yeah, they would tell us that we are if we are like lacking of sleep
Mm-hmm.
or even like they would tell us that if we need to like move more, we need to do workout. I think there's a lot of apps that able to do that. I think that's
Oh,
part of AI, right?
yeah, yes, like sleep tracking device or something like that. It's all on the smartwatch. Okay. Yeah, interesting.
Mm.
Thank you, Kak Henry. How about you, Kak Sultan? The question is still the same, and you already give us your thoughts before, so can you share with us, Kak Sultan?
Sorry, what is the question? Is it as I
Okay.
just being distracted to answer the chat?
Okay, yeah. Can you give more examples or ideas of how AI is used in medicine, Kak?
Um, uh, I think how to mix or how to combine a medicine. Does it already shout or not? I'm sorry. I'm also not listening to you all when discussing.
Okay, it's okay.
So uh so maybe as like there is a index or the database like about if this medicine got effective to cure this, what how many percent, and what and this
Mm,
medicine what how many percent, and
mhm,
then we just type like, oh, the diagnosis of the sickness is like this thing, and probability got this thing, and with the
mhm.
index they could combine it or mixing with the database also.
Okay. So it must have a database first. So we input like our condition, something like that. So maybe it can give a result what kind of disease that we got. Something like that,
Yes.
Kasultan? Ah, I see.
Yes, as
Okay.
because it calls artificial intelligence pemikiran
Mm-hmm.
buatan. So we make
Mm-hmm.
them to got the intelligence. So we also got the roles to shape them to make the legit or the database
Okay.
that helpful and beneficial to each other.
Okay. So we have to learn a lot about prompting too, Kak Sultan, right?
Yes.
Yeah, okay. Thank you, Kak Sultan. Okay, so maybe in the future, what innovations would you like to see besides your explanation before, Kak Sultan? So do you have any imagination maybe in the future how AI can help medical aspect to human, I think? Mm,
Possibility is always there, and
okay.
if I don't know, maybe what it crossed in my mind if same as what I answer before and before is related to the index thing, as maybe after the index related about this medicine thing is
Mm-hmm.
really already solid enough, the possibility that something diseases that what that some diseases that perhaps still not got the cureness could being got some innovation to cureness related to the index that they already got then.
Okay, wow, yeah. Thank you, Kak Sultan. And our host said like AI help lower malpractice. Okay, I think it will possibility in the future. So yeah, thank you for sharing with us. So I think we have like 8 minutes left. So we will move to the last questions. I think it's getting more interesting right now. So we back to Kak Nurul. Kak Nurul, the disease that we talk is about the cervical cancer, right? I believe that you are already aware about this disease. So the last question is, how can awareness about cervical cancer can be increased, Kak? Or
Can be apa?
can be increased, Kak?
Increase.
Yeah.
How
So
ya?
what are effective ways to raise public
Oh,
awareness about cervical cancer, Kak Nurul?
I think we could start from our nearest environment, like our
Okay.
family, you know,
Okay.
uh, to give them awareness about it, to our parents, to our siblings, to our uh, uh, sons and daughters. And also we can start to spread the awareness to our nearest neighbor.
Okay.
And then we can also spread awareness on our social media.
I see. Okay, so like spread the information to your closest one first. Is that correct, Andrew? Yeah.
And also to promote this kind of method to them.
I see. So this app method.
How to prevent it, how to detect it early, something like that.
Okay. I think who plays the most important roles, Kak Nurul, to spreading the awareness? Maybe the schools or your workplace, influencer, or maybe the healthcare workers is itself, Kak Nurul.
Who what?
Who plays the most important role in spreading the awareness, Kak?
I think our very individuals, like everyone.
Everyone. Okay. So because the possibility to happen is there, right? And so I think we have to prevent it early. Is that correct, Kanuro?
Yeah.
Yeah. Okay. That's a very nice thought. Thank you, Kak Nurul. So how about you, Kak Hendy? Have you heard about the cervical cancer before? I think that's the first question, I think.
Yes, and should I answer what is the ways to raise awareness about it?
Yeah.
And maybe by what is it like make campaigns about cervical cancer and make it accessible, because I think by doing partnerships with a lot of workplaces, because I think I don't know, but I feel like cervical cancer is commonly known among adult women, right? Does it ever happen to like young girls before? Because I don't know. But I feel like it's best to like partners with a lot of workplaces to raise awareness there and make it accessible for them to do checkups about cervical cancer. And hopefully it will bring more awareness even to the to the stakeholders on that workplace, and probably spread around from word of mouth or something like that.
Okay. Yeah, wow, that's a very nice thought too. After this discussion or this material, how has your view on AI in healthcare changed after this discussion? So just, oh yeah, AI can be used for this kind of thing too, Kak Hendy. Did you thought about that?
Yes. I do feel enlightened because I don't know. I feel like I see AI as something bad, but well, I think it depends on the users at the end of the day, right? If they
Okay.
have like good intention, well, the outcome would be good too.
Okay, thank you, Kak India, for sharing with us. And the last we have Kak Sultan. The question is still the same, Kak. How can awareness about cervical cancer be increased? Maybe from your design, maybe you can post any your work, maybe in
How
the
can
social media.
how can the awareness about cancer could be increased? It
Yeah.
depends on government and what thing booming in social media. It not
I see.
depends on how AI it thinks. As you know, there is a lot
Okay.
of diseases, a lot of sickness
Mhm.
that always got being sounded as it popular. Maybe we said in the rainy season, we are being there are a lot of poster, a lot of information related about be
Okay.
careful about what is this? Berak-berak, I don't know, diarrhea, diarrhea. there's there's awareness
Okay.
there's awareness about diarrhea, and
Okay.
around 2020 when the COVID awareness about COVID. So it's not depend
Okay.
on the AI also, but it depends on our community to what things to need to be more awareness enough. But in the end of the day, healthy is a major thing that we shall need to taking care of it.
Okay, so I think we have to make it viral first, right? Because it will be like the trending topic in the nation
I don't know.
itself. I mean, yeah. Okay. Wow.
Yeah.
Yeah. That's so good too. Okay. Thank you, Kak Sultan, for sharing with us. Okay, everyone. I think the time is up. So once again, I think the discussion is very interesting, right? And also the material also. We learned about the AI, how about using it in a healthcare condition. So hopefully it will help us more healthy in the future, I think, or just make us more concerned about our health itself. So I think that's all from me. Before I close the session, I would like to encourage you to fill out the feedback link after this. So your feedback and suggestion will means a lot to us committee. And also it will boost our energy to help to prepare the class in the future. So this is the link already sent by our host. So Kak Nurul, Kak Hendy, and Kak Sultan. I hope that you can fill out the link to end this session. Once again, thank you for me. And if there are any mistake from my side, so I apologize about that. So thank you, Kak Nurul, Kak Hendy, and Kak Sultan. I hope that I can see you again in the next classes. Bye-bye, everyone.
Yeah, thank you, Kak
And
Asmal.
back to you, Kak Khairunisa.
Yeah, we still have like around like 30 seconds left.
Okay.
Yeah.
Wow. Yeah, I try my best to take the time, Kak Simi. So yeah.
Yeah, a little bit chit chat, yeah, because like everyone's still in the
Okay.
room.
Yeah. Okay.
Yeah.
So, so Kak Sultan, what kind of work did you do, Kak Sultan, in graphic design? So it like advertising media or something like that?
So I was working for a beauty company right now. Yes,
Oh,
their product is something like perfume and some body care thing. So
okay.
this week I've been busy for designing the product packaging for their latest
Ah,
product, something like that.
I see. So, you handle a lot about the packaging itself, or not the advertising one, right? So it means on the
Both of them, both of them.
Ah, yeah. Okay. Wow, that's cool, Kak Sultan. Okay, I think everyone already back to the main room. So I think it's fair for me to give back to our MC, Kak Khairunisa. Go ahead, Kak Khairunisa. Thank you.
Kanisa not here yet.
Okay. Okay, welcome
Oh,
back,
she's here,
everyone.
she's here.
Yeah. Okay, Kak Khairunisa, are you here, Kak?
Yes, I'm here, Kak.
Okay, I thought you were gone, Kak. So I will give back the main room to you. Go ahead, Kak Khairunisa. Thank you.
Okay, all right, everyone. Welcome back here. How was the FGD session, guys? Did you enjoy it?
Of
I hope
course,
that.
yeah.
Sorry, yeah, we have a limited time, but I hope you had some meaningful and fun conversation, yeah, in your breakout room with the Fasil.
We need more time.
Yes, we also always need more time.
And money.
Yeah. And also need money. Okay, guys. So we move to the representative sharing session. Maybe we start from Kak Mej Group. Hello, Kak Mej.
Hello, Ka. Good evening, everyone, and good evening to our um, very inspiring conductor. Um, yeah, in my group, I have two people. Um, we have Ka, Ka Sandy and Ka Sheriff. So, yeah, I will choose Ka Sheriff to be my representative in our group. Ka Sheriff, are you there?
Yeah, thank you, Kak Mechi. It is a very fascinating group with Kak Mechi and Kak Sandi. I got many insightful, inspiring idea and information. Although I have no knowledge about the material, but the discussion give me a lot of insight. So I also share with my friend with Kak Sandi and Kak Micha about how the positive impact of the AI, especially in the medical industry. I share my information, a little information about the it's like a hospital in Bandung, Hasan Sadikin, if I'm not wrong, and also in Yogyakarta, the surgery room using AI robotic to do surgery, and the doctor don't need to enter, only control from out of the room. I think so. This is the kind of how very the AI is very beneficial for the medical industry, and we hope our conductor's idea and also her applications will be more successful for the future, especially for the human. Thank you, Kak Micha, and also all of you else. Thank you.
Thank you very much, Kak.
Thank you, Kak Syarif, for your sharing your thoughts and your discussion before with Kak Mitch. And I couldn't agree more that AI is very beneficial in medical industry, I think. So maybe we can hear from the others group, maybe from Kak Fura's group. Halo, Kak Fura.
Halo Kak Nisa. Thank you so much for the opportunity. So in my group, I have Kak Fadil and Kak Zulfa. And I would like to give a chance to Kak Zulfa to resume our discussion. Please, Kak Zulfa. Halo Kak Zulfa. Please, Kak Zulfa. Kak Zulfa?
Is all of the server is.
Are you there, Kak Zulfa? Maybe from Kak Fadil. Please, Kak Fadil.
Oh yeah. On behalf of our team, guys. So the idea is, I'm actually a public health practitioner. So yeah, I work closely with the Ministry of Health, District Health Offices, and also the public health center. So I find this AI thing is very interesting, and it must be very powerful tools for health purposes in Indonesia to have this in terms of detecting cases, because uh, as for your information, guys, the NCD is the leading causes of death, number one worldwide, and the cancer is the number two of leading causes of death worldwide. So not necessarily the cervical cancer, uh, but one of the is cervical cancer. So we are often know or realize the this cancer too late, as we are all know, because it's terminal and also its stages, right? So yeah, with this AI, hopefully we can expedite the surveillance to detect the cases not only for the cervical cancer but also for NCDs. And I also would like to shout out to uh, Aldia tadi. Oh sorry, Aldi previously said that whether the conductor wants to develop this not only for the NCD but other diseases, because it's also could expedite the other diseases, especially the communicable diseases. Because one communicable disease have like a lot of differential diagnosis. So, for example, like the MR, the measles and rubella, all the diseases that have dilations and also this papule as a symptoms, this AI could detect this and it could easily differentiate those symptoms based on the diseases itself. Especially, like MR, they have like differential diagnosis, smallpox, chickenpox, measles, rubella, mpox. So with this, we can expedite the detections, and hopefully AI would be a thing here in Indonesia. But the thing is, the AI is we Indonesian are not very aware of the AI, especially in the stakeholders and the what we call it, the policy decision maker. So we need to have like a specific strategy to approach them in terms for them to willing to why they're implementing this AI throughout our nation. And I do believe that if it's implemented, then we can at least our surveillance system is will be better, and also yeah, that's it. Back to you.
Okay, thank you so much, Kak Fadil, for sharing your thoughts and perspective with us. Yeah, it's very interesting to hear your perspective. And all right, everyone, we have officially reached the end of tonight's session. But before we officially wrap up tonight's session, maybe we can hear a closing statement or message from our amazing conductor. Halo, Kak Nidya.
Hi. Oh my God, I'm so like overwhelmed about how excited your response are. I'm so grateful. Thank you so much. Maybe we can learn together if you want to know more about HerLens, or maybe there are people who are asking me about Apple Developer Academy or Bangkit Academy. You can reach out to me to my Instagram or LinkedIn if you want to ask something. Yeah, feel free to reach out to me. Hopefully, this can be a very useful session. This can be like an inspiring and eye-opening session, because uh, I hope more people can know that AI is more than like just ChatGPT, or maybe just for like fun deep fake videos. No, it's more than that. We can use AI for many useful solution for humankind. Yeah, thank you so much for having me tonight.
Okay, thanks a lot, Kak Nidya. It's so great to having you in this class. And I'm pretty sure that everyone here agrees that tonight's session was so inspiring. Thank you, Kak Nidya. And once again, thank you for joining Britzone Thursday class, you guys, for your time and for your sharing your thoughts with us. And also don't forget to fill out the attendance form and give your feedback. It's really help us grow and create even better session in the future. And have a good rest tonight, guys. And see you in the next class. Bye-bye, everyone.
Bye-bye, everyone.
Bye. Rest well,
Bye
guys.
bye. Thank
Bye.
you.
Bye-bye, you too.
Kak Dida.